Hi, everyone. My name is Brennan Olson. I'm an MD PhD student in the laboratory of Dr. Daniel Marks at Oregon Health and Science University. And today I want to talk to you a little bit about this molecule called Lipocalin-2 and its potential role in appetite suppression during pancreatic cancer cachexia. So very briefly, cachexia is this devastating state of malnutrition in which patients experience a decrease in appetite, yet paradoxical increase in basal metabolic rate. And this is really an unmet clinical need, and this is what our laboratory studies. I came across this paper a while back now suggesting that lipocalin-2 may play a role in appetite regulation under physiologic conditions. However, it's really not been investigated in the context of disease. So the impetus for these studies is really to ask that question: is lipocalin-2 associated with food consumption in the context of pancreatic cancer cachexia? So in order to study this, we use 5 separate pancreatic ductal adenocarcinoma associated cell lines that all induce varying degrees of appetite suppression as well as skeletal muscle catabolism. And really a unifying theme across these cell lines is we see a significant negative correlation between plasma lipocalin-2 levels, as well as lipocalin-2 levels found in the central nervous system, as indicated by cerebrospinal fluid levels, and food consumption and skeletal muscle wasting. So we next wanted to ask the question, well, what happens when we delete lipocalin-2 from tumor-bearing animals? Is there a protection in anorexia as well as skeletal muscle catabolism? And indeed, it looks like that's the case. And importantly, we notice that in lipocalin-2 knockout mice, there isn't any detectable lipocalin-2 in the periphery or in the brain, demonstrating that the tumor itself does not secrete measurable amounts of this molecule. Since the literature suggests this molecule binds to the melanocortin-4 receptor in the paraventricular nucleus of the hypothalamus, we wanted to see if blocking this interaction using a Goody-related peptide would improve feeding behaviors as well as skeletal muscle catabolism. And indeed, we did observe that trend. We then asked the question, is the skeletal muscle gain in the context of lipocalin-2 deletion a result of increased food consumption alone, or is there something specific happening in the skeletal muscle compartment? And to do this, we pair-fed lipocalin-2 knockout animals to their tumor-bearing wild-type counterparts and observed that these animals had equivalent skeletal muscle loss, suggesting that lipocalin-2 improves skeletal muscle gain strictly through an increase in food consumption. And finally, we observe these trends in patients with pancreatic cancer as well. We see an increase in lipocalin-2 levels at diagnosis and as well as follow-up for several patients with pancreatic cancer. And we again see this trend of increasing lipocalin-2 is associated with a decrease in cross-sectional skeletal muscle area using axial CT imaging. And finally, this association also holds up in terms of survival. That is, patients with an elevated lipocalin-2 level at diagnosis have an increase in mortality. So finally, in summary, lipocalin-2 is robustly upregulated in the periphery and brain during pancreatic cancer. We know that deletion of this in our rodent models protects against anorexia and lean mass loss. Antagonism of this molecule in the brain improves food consumption and lean mass gain. Pair-feeding mice abolishes any muscle gain that is observed in the context of lipocalin-2 deletion, and we observe these trends in human patients as well. Thank you very much for your time.